Hey everybody, welcome to the discussion on precocious puberty.
Precocious puberty is just a way of saying that puberty has clocked in way too early. For boys, that means that we are seeing those pubertal changes less than 9 years old. And for girls, that means that we are seeing those pubertal changes less than 8 years old. So what does it look like? We can see things like acne, menarche, reproductive ability, breast development in girls, the development of adult body odor, rapid bone and muscle growth, or rapid changes in body shape and size, the development of facial and body hair, enlarged testicles or penis, deepening voice, and pubic and underarm hair. So you might be asking yourself, how does this all come together? Well, it starts in the brain, with a thing called gonadotropin-releasing hormone. As gonadotropin-releasing hormone is released, the pituitary gland is stimulated, thus responsible for LH and FSH, which is luteinizing hormone and follicle-stimulating hormone. The gonads are then stimulated, which release either estrogen in females from the ovaries or testosterone from the testicles in males. As these hormones are on board in large quantities, we then see this all come full circle in the physical changes that we described before.
So now that we have an idea of what's going on in the brain, let's talk about what those underlying causes could be. It could be idiopathic, an infection, a hormone disorder. It could be a tumor or a brain abnormality or a brain injury. When I was a new nurse, I recall having a patient who was a trauma who came in that was hit by a car. She had suffered a TBI that was very significant. And she had some pubertal changes that we saw start happening at age 6. And so at that time, I didn't fully understand what precocious puberty was and what all it meant, but now looking back, I can definitely wrap my mind around that a little bit better. When we're considering who's most at risk, we know a certain populations come forward. Girls, especially African American girls. People who are exposed to hormone supplements, such as like an estrogen ointment or a testosterone supplement, and a few underlying conditions that include McCune-Albright syndrome, congenital adrenal hyperplasia, abnormal androgen production, sometimes with hypothyroidism, or someone who's received radiation of the central nervous system.
So we ask ourselves, what is the big deal about this? What can really go wrong with the fact that these pubertal changes are happening early? Well, there are two long-term ramifications that we see. One, we see that the height tends to be very shortened and there's early stalled growth, as well as social and emotional problems, largely stemming from bullying for the changes that we're seeing, where your patient may question, what's wrong with me and why am I different than my peers?
As we look to make a diagnosis, let's hone in on a few areas. We want to look and see, what does the past medical history tell us about this patient? Is there any family history of precocious puberty? What is their physical exam like? Do we see those changes that we talked about earlier? What about blood tests? We want to look at their hormone levels and see where they're sitting. Do they seem appropriate for someone at that age, or do they look more like pubertal levels? The other thing is to look at bone age films. This tells us a lot about the individual. Is their bone age actually matching up to their true age, or is it looking like they are older, judging by their bone age? We can shoot films of their hands, and that tells us a lot. So we've reviewed what it is, what do we do with it, what does it look like, how are we going to treat it now? That's what we really need to know as clinicians. So we look at the options that we have, and currently what we do primarily is an injection monthly of Leuprolide or Lupron Depot. And we do this until the normal age of puberty. And basically, these are medications that are going to help stall those changes that we see. So that way we don't see those long-term effects, such as the shortened height, as well as the social and emotional problems that are coming with that. Or, if it's something that we can treat the underlying cause, we need to be focusing on that. Thanks for taking a listen, guys. I hope you found this insightful. I know I definitely found it interesting to look into, and hope this helps you with your future practice.